it's me. It's Wednesday the 13th. Woo! And had my last appointment with Dr. Blanchard yesterday before my scheduled surgery, which is on Tuesday the 19th, so 6 days from today. And I went in there having decided to have peace of mind and go ahead with the bilateral mastectomy. And we asked her, Wade went with me, and we asked her a lot of questions. And I've been watching videos on YouTube of women who've had bilateral mastectomies, and as much as it's, according to Dr. Blanchard, a slow growing and very small mass. And I found out yesterday that another factor that determines chemotherapy, other than it being in your nodes and oncotype scores and stuff like that, is the size of the actual mass. That's the IDC part, which was the invasive ductal carcinoma part. My mass, sorry, Holly has a cold and I think she's passing it on again. It's all going around and around. Anyway, the mass that I have originally measured at 2.3 centimeters, but that includes the calcification, and she didn't think that the actual invasive part is big. She says it's probably well under a centimeter. Now, if it's over a centimeter, the bit that's actually invasive and in my tissue, rather than in the duct, if it's over a centimeter, you have to do the oncotype score thing, I think. I'm not entirely positive, but has to be over a centimeter that's invasive. Then they do chemo as an adjuvant therapy. I think that's the word. I don't know. Anyway, she still, knock on wood, doesn't believe that the actual invasive part is over a centimeter. But I think she's very pro tissue preservation. I read a lot of articles last night as well. Wade sent me some, I sent him some. Because I've had so much trouble sleeping. This is the hardest decision that I've still not made. And peace of mind really weighs heavily in this decision, and I don't know that I will have peace of mind if I don't get the bilateral mastectomy. But the survival rate, and I hate saying that, is the same either way, of this cancer, this one that I have right now. Recurrence is higher with a lumpectomy and radiation because obviously you have kept most of your tissue. It could recur on either side, and it can be dealt with again. Thing is, even with a single or bilateral mastectomy, you can get a recurrence because you don't lose all your tissue, you lose about 95%. So although it's a much lower risk, it's still a risk. And then there's also the risk of metastasizing, which means it could a cell could go and make its home somewhere else on your body, in your body. And that's the same in either case. The thing is, I know that it does come back with, not does, knock on wood, it can come back in either case. I know of a lady who had it recur after mastectomy, and it can recur in several places. It can recur in the incision line, it can recur in, and Dr. Blanchard told me yesterday, it can recur in this area here because it's hard to remove all your breast tissue. it's hard to determine where the breast tissue ends and the actual body tissue starts. So this is an area they look out for. And right here is an area, well, on my body, it's hard now because of the tummy tuck to see any, like, bit that's not breast. But those are two areas where it can recur on a mastectomy site. Now, the surgery that I've booked, which I can cancel till the last minute, can't cancel it after it's done though. The surgery that I've booked is the lumpectomy and reconstruction, which will involve an incision up here because my cancer is here. That's the site of the original biopsy. This is the site of the one, and it's still got a line across from the steri-strip, almost like a burn. But this is the line, the mark from the original biopsy. So I will have an incision here, and I told her, you know, if I'm doing this reconstruction with reduction of breast tissue, she could take as much as she wanted to within, you know, the scope of how much I'm taking. I'm losing size-wise, and then she can. Dr. Faladay said he can refill with fat grafting from my actual breast tissue. But she says she's going to take what she needs, obviously the cancer and then the margin. And then because I've got the 2+ hours of reconstruction, they're going to do the preliminary testing on the tissue. In 20% of cases, women have to go back in to have more tissue to get a clear margin. And then apparently only 1% of cases where there still isn't a clean margin, then they have to go in again either to have more tissue removed or a mastectomy. So what's going to happen at this point is I'm going in on Tuesday. I'm going to be injected with the dye. No, the Y will be put in one place. I'll be taken to have the dye put in a different place. I've already explained this. Then I will be taken back, and then I will be put to sleep. It will be taken out. The sentinel node will then, I'll have a cut, and I'll have a sentinel node removed. I've been using the laser because I won't be able to shave there for a while because of the incision, but it will be fine. Because I've been lasering for a while there, so I don't really get much hair on my armpits. I'm sure that's very interesting information. They will test the sentinel node. If there's any cancer in it, then they will take more nodes out. And that's, again, a thing that determines chemo. I was looking at ice caps yesterday that have been developed by a company in England, and there's another company in the US that does it now. Has been doing it for like 10, 15 years or so. It's a way of not losing all of your hair during chemotherapy, in case. It frees, basically, it's these things that are filled with gel or something, and you wear them on your head during and after, for several hours afterwards, and it kind of freezes all the nerves in your scalp. And it's effective in a lot of cases, and you don't lose, a lot of women are successful in not losing all their hair, but then there's all this discussion about stuff that can happen to your scalp and stuff. Anyway, don't know. But it was something that I'd never heard of until last night. Anyway, so then after about 3 days after the surgery, after that happens, then she will close up, I guess, I don't know. And then Dr. Faladay will do the removal of extra tissue, and that means cutting around the areola, cutting underneath, basically a pie shape. You get the smiley face underneath. They remove a bit. He repositions the nipple higher up, because otherwise it would be like underneath the breast. And then that is kept intact. It's not a graft. It's all the way down to the chest wall. The nipple is dissected all the way down to the chest wall, then repositioned, pull through. And that's what's going to happen. But still, if this is the way I go and I don't change my mind again for the 50th time, that's what's going to happen. So I will then have whatever treatment I have on this side. Now, radiation will be mostly on the entire breast and then focusing on the cancer area. That kills whatever cells might still be floating around in there. And then after that, because that radiation can actually shrink the breast again a little bit, that's when I will get reconstruction on this side, so that it matches as closely as possible to this side. Or, and that will happen maybe 4, 5, 6 months later, so I'm going to have uneven breasts, I'm going to have to wear the bras that I wear now, but I'm going to have to wear something on this side, because otherwise there's going to be A, no support, and B, it's going to look different size-wise, and it'll be obvious. So I'm going to have to get some kind of, I don't know, I'm thinking about getting a silicone sort of piece, I don't know, to push it up or something, I don't know. If I had a bilateral mastectomy, it would require days in hospital, 2, maybe 3. It would also require possibly, very likely, no radiation, longer recovery period, no breast tissue, no sensation, more peace of mind, and lower risk of recurrence. But as I said to Dr. Blanchard yesterday, you know, I breastfed my children. The work of my breasts is done. And a lot of women who have breast cancer feel that they're just killers. When you hear you've got breast cancer, you think it's not a breast anymore, it's a killer. I mean, I was going to get reduction, but I had chosen the tummy tuck because I really hated my tummy more than my breasts. The thing that I don't like about my breasts is the pain that I get if I don't do weights. I've already decided to call them Franken boobs. I have no option but to do something about them now, so I mean, it's the removal of all breast tissue or the rolling of the dice and hope that this is the solution, what Dr. Felidy suggested. Anyway, I'm wearing a top today that I got for Christmas. It says, "Nobody cares if you finish first. Walk with courage, fearlessly, run fearlessly, finish with strength." And it is cute. And then I'm wearing a pink top that I've had for years. Probably wore it when I was YouTubing before in 2012 and didn't know that this was going to happen. This is probably, if I don't make another video, this is probably the last time my boobies are on video. We're going to have a party. I know this is so stupid, but we're going to have a leaving party for this one on Sunday. I thought we were going to have a leaving party for both of them, but we're going to have 2 now, apparently. We're going to have a leaving party for this one on Sunday, and then whenever this side gets done, we'll have a leaving party for that one. Oh, I got my IPSY thing, so I might do another video before the surgery on Tuesday. So anyway, my nails are this. Very boring because they're still the same as before, but I've put more of the pink glaze. I mean, I don't know when the last video, I think it was a week ago, over a week ago, and this stuff is really great because, you know, as long as you upkeep, you're good with the upkeep. It stays, it doesn't chip, because I put so many coats on, it can't probably, and yeah. So other than that, I just don't know what to say because I'm still on that fence, and I'll be on that fence until something actually gets done. It seems that from studies, the bilateral mastectomy is, as much as it's growing in the US again in the last 10, 15 years, it isn't in any other country in the world. But I think it's the fear of I mean, you cannot imagine what it feels like to be told that you have cancer. I mean, you just cannot imagine until somebody tells you you have cancer. You cannot. You can try to put yourself in somebody else's shoes. You can be sympathetic to their, I don't know, situation, diagnosis, but you cannot understand the enormity of it, unless it's happened to you. You can't. It's just, I never imagined what it would feel like to find out, what it would feel like to hear those words. I had conversations with Billy the other day about different, finding out that you have cancer in other places, like, say, your leg, for example. Touching wood, knocking on wood. If you find out you have it, say, in your calf, do you remove your whole leg? No. Not unless it's spread everywhere. You remove maybe from below the knee, and you can then have a prosthetic leg. You don't remove the whole leg just because it's somewhere beneath your, somewhere from the knee down. Because I don't know this, because of obviously, I don't know this, but I would imagine that it's harder to use a prosthetic, or impossible to fit one if you've got nothing to fit it onto. So below the knee, I would imagine it's the easier, it's not even a word that probably is suitable here. What I'm saying is that a leg is important in order to be mobile. If you've had legs and blah blah blah, I know that there are many people that are mobile in wheelchairs. But if you don't have to remove your whole leg, why remove your whole leg? If you have it somewhere else that's an important part, you don't remove the whole thing, I guess. I don't know. If it's systemic, what, do you remove your whole system? This is a lump in my breast, a very small calcification. Do I remove the entire breast and a whole healthy breast in case it comes back, or I forget, a secondary one? That's the question, and apparently it's no better getting the larger surgery than getting the lumpectomy for this particular cancer and my survival chances. It's still the same for this particular cancer. That's not to say that I won't get a secondary one or whatever. It's what I'm told and what I'm led to understand. Now, that's the dilemma. Peace of mind. Of the women that I've spoken to who've had the bilateral mastectomy, none of them has regretted it. Of the women that I've spoken to who have had the lumpectomy, they've not regretted it either. Dr. Blanchard doesn't think I need the mastectomy, but she's not going to tell me which way to go. She says it's my choice, and neither choice is a wrong choice. So if I have one, she'll do it. If I have the other, she'll do it. It's my choice, my decision, and it's a very hard one to make. I don't know. But it's booked in for the lumpectomy on Tuesday and the rebuild on this side. So that's about it. I can't think of anything else. The recurrence thing, she also told me that if it were to come back on this side, that I would then get a mastectomy because of the radiation. they can't redo radiation on it, so I'd have a mastectomy, and then I could, because they wouldn't remove the skin, I could have an implant. So they would put underneath the muscle wall the, whatever it's called, I forget now, that they put under the muscle wall to then inflate the tissue underneath the muscle, the expander, that's it, and then they put in an implant. So I would still be able to have something there, unless they did the flap thing, which is taking half, like not half your back, but a flap from your back, because they can't take a flap from my tummy. They'd have to take a flap from my back, which was then you can hide underneath your bra strap band, the bra band, and that. So I mean, that was another thing, because I didn't want to end up with no breast, but I'd rather end up alive, so you know, that's actually the point. That's it. So that's what I've decided for this minute, because I'm going to change a whole lot of times. Oh, and another thing is, if you need to take something to sleep, and people are telling me this, and I'm going to say the same thing, and maybe I'll listen to myself. My primary care provider gave me a prescription for Xanax. I told her that the ones that she gave me, the pills that she gave me during the summer, I still haven't started them. I have them just in case. I've taken like my old ones from 2006, half doses, so 1/4 milligrams of those before an appointment. I didn't even take one yesterday at all before talking to Dr. Blanchard. So I've taken them at the beginning before appointments, because it's so stressful and so panicky. But I can't sleep, and so I went to the doctor last week about something else. And she said, my primary care provider said, I said, could you give me another prescription, because I'm going to start probably taking the ones that you gave me last summer that I've cut in half, next week, because of the surgery. I'm going to take some before I go in. I've been told it's okay, because I have to have all this stuff done before I'm put to sleep, and I'm going to be climbing the walls. So I said, could you give me some, just because I haven't been sleeping? And she says, look, if you need something to sleep, her mother-in-law had a lumpectomy last year and radiation, and she said, if you need something to help you sleep, take it, because you need to be rested. And I've been thinking that I should take some, and when I'm up and I'm watching YouTube videos or reading about this and the options and the pros and cons and weighing the pros and cons and writing lists of questions, I've been up, all night and things, and I'm tired, and you can probably see the bags under my eyes. And she said, if you need to take something, because you do need to sleep. And so by 6 o'clock in the morning, I'm thinking, I need to get some sleep. I got 90 minutes of sleep last night without taking anything. That's great. Then I was up the rest of the night. And then this morning I thought, I've got to get a nap. So I took half of, it's a 1/4 milligram pill. And I was up 2 more hours, and then I finally got a nap. So if you need to take something to sleep, take it. Ask your doctor. They willingly give cancer patients stuff so that you can sleep, because this is stressful and your mind is going all the time. All the time your mind is like working like this, like this, like this. You've got 600 hamsters in the wheels in there, and they're turning, and they're coming up with different scenarios, and it's all in there, and you need something so that you can sleep. And if you need to take something, okay? That's it. I'm sorry this has gone on so long, but I just needed to flip and get some stuff out. Thanks for watching. Thumbs up if you like the video. Pass this along to someone if they want to be confused about breast cancer too. I don't know. I don't think this is going to help anybody. All right, thanks for watching. I'll see you next time. I'll try and do an IPSY video so that it's less depressing. And bye.